Hi there, my name is Nikki and I suffer from 3 rare diseases: Tarlov Cyst disease, Ehlers-Danlos syndrome, and Chiari malformation 1. My YouTube channel is going to be dedicated to raising awareness, educating, and empowering sufferers with Tarlov Cyst disease. In September of 2016, I had surgery to treat 10 cysts in my sacral area that were compressing 7 of my sacral nerves, and I was given miracles with that surgery. And basically, I feel like I have to do everything within my power to try and honor Him for the miracles He gave me with my surgery, because I was in excruciating pain for a couple of years really before my surgery, and the sheer amount of pain relief alone from my surgery was like being released from a supermax prison of pain. I didn't realize until the pain was gone just how much it encompassed my entire life. I had already basically done videos of my goals for my videos as well as my own journey, but I have since upgraded my studio and all that, so I wanted to reshoot them in a more professional way because they're not very high quality videos, and I just wanted to go ahead and do them again. So for any of you that have already watched my journey and goals videos, I apologize for the repeat, but I wanted to get a nicer, higher quality video done. As far as my background goes, I am a scientist basically. I am not a doctor. I don't have any medical training, and I'll never claim to be a doctor. But I do have a Bachelor of Science in Chemistry, and my career was basically a number of years were spent being a procedure writer or a technical writer in the commercial nuclear power field. And so I have a lot of experience taking large amounts of very technical information, reading them for understanding, and basically preparing them for a normal person to understand. So that part of my career, I feel, really prepared me to be able to make these videos and try to explain some of the lesser known and little known aspects of our disease, how it all fits together, and that kind of stuff, because there's a lot of information as far as, you know, what a Tarlov cyst is, and anything that's already really covered in the YouTube arena, I'm really not going to glance over. I'll just refer you to those videos. Basically, I just found that in my own journey, there was hardly anything out there for Tarlov cyst patients other than surgery testimonials, and so that's, you know, the reason why I want to do these videos. Some of them will be very technical and informative, and others will be more emotional, because I truly didn't grasp just how much of my recovery from surgery was going to be an emotional journey instead of a physical one. And so I will probably have a number of videos that are just personal in nature. It'll be a mixed bag. As far as my journey with TCD goes, basically it started around late 2009, 2010. I had woken up with foot drop, and I had been having some low back pain, and I'd never had low back pain before in my life, never any injury or anything like that. And about 6 months prior, I had had 2 spinal taps because I had had a constant, never-ending headache for 2.5 months. Nothing would touch it, no amount of pain medication or anything like that. And as soon as they pierced my dura and let the pressure off of my cerebral spinal fluid, system, the headache resolved while I was still on the table. And so I was diagnosed with intracranial hypertension. And truly, it's kind of a chicken or the egg kind of thing, because, you know, basically the intracranial hypertension could have been caused by my Tarlov cyst, or the spinal taps could have caused some of my cysts. I don't know. But I also have Ehlers-Danlos syndrome, which I consider the systemic cause for my multiple cysts. It's not uncommon for us to have a connective tissue disease along with Tarlov cyst disease, and most commonly it is Ehlers-Danlos syndrome. So basically, on my MRI, nothing was discussed with me as far as my Tarlov cyst or perineural cyst. You'll hear them referred to interchangeably. And so fast forward to 2014, I had increasing back pain, but that was really my only symptom, is the back pain, and no one could tell me why. And so I moved back home in 2014, and I got copies of all my medical records. And I was actually going through all of my MRI reports, and there it was, that I had multiple perineural cysts bilaterally on my S1, S2 nerve roots. And so in about July of 2015, I actually lost feeling in my urethra. It was the first new symptom that I'd had since the back pain started in late 2009, 2010. And once that new symptom came on, my symptoms came on like an avalanche. I went numb. I ended up going numb completely below the waist, basically from my belly button to my butt crack, for lack of a better way of putting it. But my urethra went numb. My bladder, basically, I was having to go to the bathroom 20 to 30 times a day. I always felt like I was about to burst, but when I would go to the bathroom, it was only a very small amount. And if I did not get to the bathroom within 30 seconds to a minute, I would wet myself. My bowels, I lost absolutely all function to my bowels. The nerve signal was absent. The nerve signal that causes motility or causes your system to move was absent. It was not constipation. There was no gas. There was no cramping, nothing like that. I had to basically use laxatives once a week to clean my system out, and also do manual evacuation, which I have a video on how to perform that you can review. The pain was unbearable. A lot of diffuse low back pain. I had radicular pain down the back of my right leg that terminated at the knee. Lots of cramping in my calf muscles. My feet were constantly bothering me. My legs got progressively weak until the point of where they were so untrustworthy, and I was falling so much I started using a cane. I was on a cane for about 6 months prior to surgery, and I was concerned that I was going to be in a wheelchair if my surgery was not approved soon. A lot of people have problems with sitting. I didn't have any problems with sitting. I could sit for extended periods of time. In fact, that was the only way I could ever get anything accomplished, was I would sit down on the ground and work within my arm's reach. I did have problems standing for too long, and I have intracranial hypertension, so I did have a lot of headaches and that kind of stuff that I do attribute to the cyst actually filling and emptying at certain rates. For years, it was thought that I had 3 Tarlov cysts, but when I finally had a full sacral MRI in February of 2016, it was discovered that I actually had 9 on my MRI. I had multiple cysts on my S2 right and my S3 right. And so I was concerned about arachnoiditis because I already had clumping type cysts. But I had my consult in April of 2016, and due to unforeseen problems, I actually developed 3 blood clots in my left leg. I wasn't able to have surgery until September of 2016. And so I'm about 14 months post-op, and truly almost every problem that I had prior to surgery has been resolved. The only thing that got worse after my surgery, because I did develop a spontaneous leak a couple weeks after my surgery, and I did have to have a second surgery because of that to fix the leak. And the only thing that got worse was my bowels. And I made absolutely no progress with my bowels for 9 months after surgery. But then things started progressing. And actually, seemingly overnight, about a week or two ago, I had a lot of the feeling return to that area, and my bowels have basically kind of returned to normal in all aspects, except for the fact that I have been unable to use them for so long that the muscles are severely atrophied and just weak. And so I've got to take the next step in treatment, which is going to require a device that I'm trying to purchase. And so I'll make a video when I get all of that, because I think it'll be helpful to those of you that do suffer with bowel problems, because most of the sisters I know that suffer with that suffer in silence. They don't talk about it. I'm not that way at all. I'm not uncomfortable talking about any of this stuff, so I'm an open book when it comes to that kind of stuff. But I'll make a video about that when I actually get the device. My insurance won't cover it, but it's going to be well worth it to me. There are a number of symptoms that go along with Tarlov Cyst disease that I haven't listed and I don't have. I highly recommend looking at the Tarlov Cyst Disease Foundation website for a really good list of symptoms, as well as all the other great information that they provide. And I will say that, my ultimate dream after I had surgery and I was given this amazing new life was that I wanted to get my master's in social work so that I can actually work as a counselor for people that suffer with chronic pain and illness. But I've had a couple of derailments in the past 14 months, and so I'm not really stable enough to commit to that kind of program. And so the first thing I did was I started my own Facebook group that is positivity driven, called Tarlov Cyst Disease Positive Outlook. So if you need that in your life, please check us out. We are a closed group on Facebook. And also I have this YouTube channel and also my website. And that way I can do these kinds of things where I feel like I'm raising awareness and I'm educating and I'm empowering patients. But if I have to be out for a week or two because of a flare or what have you, the world doesn't stop as it would if I was getting my master's degree. So basically that's my story and my goals. And I hope that you will tune in and watch my videos and give me lots of feedback and ideas on things that you may want to know more about, because more than likely, if it's anything to do with Tarlov Cyst disease, I've researched it and read about it, and I'm glad to try my hand at making a video about it if it's going to be beneficial to you, because all of this is worth it if it helps one patient. That's all. All the work in the world is worth it to me as long as it helps people. And, that's the true reward that I get out of this. And so I hope that you'll come along on this journey with me and share your own journeys with me. And stay tuned and have a great night. God bless.